So the CARE program basically strives to increase knowledge about knowledge and accessibility about supports and services throughout the community to basically help improve the health outcomes of our residents. And ultimately, the goal is to try our best to decrease 911 activations by connecting some of our high utilizers with more appropriate services. Being able to dispatch basic life support ambulances to some of our lower acuity needs in the community, we allowed our advanced life support ambulances to be available on average an additional 85% of the time. Also, what we saw is that with this program, because we were educating our providers in the community to be able to notify and identify our care team about unmet needs of the community, we actually started to see an increase of referrals to our team where our providers were kind of stepping outside of that traditional public safety model where they saw, hey, here's a community member who does need some additional services. So instead of consistently just going out on the call, checking their vitals, possibly taking them to the emergency room, and that's it, they decided, based upon what they were seeing, is, hey, this person needs a little more assistance.
Like many other communities across the country, we are seeing this overwhelming growth in low acuity calls for service on the EMS side of the house. We saw extended wait times at hospitals. We saw patients that simply didn't know the appropriate resources to call. So 911 was an easy, accessible outlet. And we started seeing a drain on our high acuity resources because they were tied up on low acuity calls. So that was truly the genesis for this program. The focus is always on the community and finding non-traditional ways to serve the community. One of the objectives for the Henrico County Division of Fire is obviously continuous improvement. And part of that continuous improvement is finding innovative solutions for community members that are non-traditional in the fire service. Our agency continuously looks for opportunities to not only be 911 responders, but also identify at-risk populations, connect those populations with programs in the community that not only keep them out of the 911 system, but also allow the emergency high acuity resources to be available for the high acuity calls. So the program directly aligns with our agency's strategic direction, and it also closely aligns with the spirit of continuous improvement.